The Connecticut Health Foundation started 25 years ago with a big mission: improve the health of Connecticut residents. By most measures, Connecticut was one of the healthiest states in the country, but data showed that not everyone had the opportunity to be as healthy as possible. There were, and still are, large racial and ethnic health disparities. The Foundation's board decided to take a strategic approach, one that guides CT Health's work today.
They wanted to be an agent of change, to use our dollars as leverage to drive not only a good outcome for one person, but rather for many that will follow that individual.
If you've been around the Foundation, you've heard talk of systems change. That is, working to change the policies, rules, and practices that influence the opportunities each person has to be healthy. It's a way to try to get to the root of the problem and to have the biggest effect possible. The Foundation's work on oral health illustrated this approach. In 1999, Connecticut was among the worst states for oral health care for low-income children and adults.
When we started this work, kids were losing more days from school because of dental pain than asthma. That doesn't have to be the case now. Only 12% of continuously enrolled children covered by Medicaid were gaining access to treatment.
The Connecticut Health Foundation worked with many partners to change this. The Foundation commissioned a blueprint on oral health in the state. It funded advocacy and supported a class action lawsuit that led to higher Medicaid rates for dental care. Collaboratives of providers worked to coordinate care at the local level. Experts provided technical assistance to those in the field. This got results. By 2013, Connecticut ranked first in the nation in the percentage of children covered by Medicaid who saw dentists. Research found that untreated dental decay in children under 5 dropped by half.
We are practical. I think our legacy is saying, what's the problem? We can't solve every problem. Where is it that we have an opportunity? What are the problems? And then how are we investing in the solutions?
But we know we can't change systems alone.
We can't do our work without a diversity of people, both at the ground level, working in communities or in state agencies, or in public life, or even in the corporate arena.
The Foundation's Health Leadership Fellowship Program, an academy for health equity, advocacy, and policy, brought together people from all backgrounds with a personal stake in addressing racial and ethnic health disparities.
We now have, as a foundation, over 200 fellows across the state, working in agencies, working in community organizations, working in public advocacy.
In 25 years, the Foundation has worked on a host of issues: children's mental health, integrating behavioral health in primary care, piloting new ways to deliver care, ensuring more residents have health care coverage. Addressing racial and ethnic health disparities was a priority of CT Health from the beginning. In 2013, the board decided to deepen the commitment by shifting the focus entirely on health equity.
We made a very important strategic decision as a board to be sure that we focused mostly on health equity as a theme and as a value for us in every way that we possibly could.
That meant ensuring that more people have access to better care, especially those who disproportionately lacked access, people of color. This year, CT Health began a new strategic plan. The goals include ensuring all residents have healthcare coverage, sustainable funding for community health workers, and investing in advocacy. It also includes a new focus area, maternal health equity for people of color.
We have kept our goal consistent. We want to see the structures change in Connecticut so that we can have a state where people have the opportunity to live their healthiest lives. Part of what we ask ourselves all the time is, what have we learned from the past and what can we do better today?
What is the Foundation's legacy so far? And what's to come in the next 25 years?
You now see a conversation around health equity that was not even conceivable when we started our work. The fact that it has been embedded in state initiatives and other health institutions' goals is not necessarily our legacy, an example of impact that we help foster.
I believe that we're making great progress. We've got to be sure that we have the policymakers engaged and talking to the people who are on the ground.
We don't do it by ourselves. It's all about partnership. It's about collaboration.
As we do our work today, I think about where will we be in 10 years, in 25 years, in 100 years? We are working on problems that took 400 years to develop, but we don't have 400 years to solve them.
As we celebrate progress, we know there is more work to do.